So as you look around the world of development, you see enormous successes, and we also see enormous failures. Part of the agenda is to understand, make sure we understand why we've succeeded where we've succeeded, and deeply why we've failed where we've failed. We believe that one of those distinctions is distinguishing where the process of mimicry can be effective and where it isn't going to be effective, no matter how long you try. So we want to think in terms of this simple 2x2 table, which is, was there mimicry involved? Did you simply mimic forms that have been done by others, or did you innovate something new? And then secondly, were there results from the mimicry? Did it lead to the results you desired? So one possibility is that you actually can do the activity just by mimicry. So we call these effective mimics. And as we'll see, the effective mimics tend to concentrate in areas where the implementation capability required for success is of a certain type we'll call logistical. So for instance, the number of children who go to and complete primary schooling has skyrocketed. Over the development era from 1950 to 2010, the average years of schooling completed have gone up by 3 times as much as they went up in all the previous history from the beginning of man to 1950. Massive success in building schools, putting kids in those schools. Vaccinations of children. Vaccinations of children have increased, dramatically reduced the death rates of children from infectious diseases that are vaccine preventable. And the process of spreading vaccinations was largely just mimicking the implementation that others had done and using, vaccines that had been invented once in the world and then disseminated. Now, we also have where we get results without mimicry. And these are effective innovators. These are where you can't simply borrow success from elsewhere. You really can't, you really do, in order to have a wheel that works in your context, need to reinvent a wheel for your context. Unfortunately, lots of the areas in which there's been lots of effort towards development success and few results are down here, where we have failed mimics. And a large part of what the entire process of PDIA is about is attempting to move from failed mimic to effective innovators. Because you're in spaces, you're in activities like the actual enforcement and implementation of law, like actually producing learning out of children's school, like dealing with health conditions that are more complicated than vaccination, where you actually need high levels of implementation capability, and that capability cannot simply be mimicked. So we see around the world schooling systems in which the children go to school, but they actually learn almost nothing. Moreover, we see schooling systems where children go to school and aren't treated well. So for instance, in India today, surveys show that less than half of children in government schools can do simple arithmetic operations even after they have completed grade 5. So while we've been effective at expanding a system, we're not yet effective at doing the complicated things the system was intended to do. So around the world we see these mimics, and the difficulty is pulling out of being failed mimics into effective innovators. Of course, not being a mimic isn't in and of itself the guarantee of success. There are lots of ways to fail that aren't replicating the success of others. So we also have lots of failed innovators. And the goal of PDIA is to address how you build an organization's capability to move from failed mimic not just into the innovator space, but into the effective innovator space.